That committee, we are doing really well this morning. So I will direct your attention if you need something to do while people are logging on. We do have written testimony from Rochelle Colombo. Okay, Jenna, can you give us a overview of 2158 and any differences to our mirror bill that we had in the Senate, please?
Yes, Mr. Chair. Sorry, I was a bit late. WebEx was being difficult. Just let me in. House Bill 2158 would make permanent provisions for the Advisory Committee on Trauma and the Statewide Trauma System Regional Council to conduct closed meetings as well as to keep their privileged records regarding trauma cases. And this would be the same as Senate Bill 170, which this committee heard, and it passed the Senate on a vote of 39-0. And I will just briefly go through the provisions of this bill. Each time that, generally speaking, each time that a bill or a law gives an exception to an open records or open government type of document, the typical provision would be to put in a 5-year sunset, and that's what this bill had, that the provisions for this body to keep their records of their meetings closed would expire on July 1st, 2021. And this bill on page 4 would strike all of those sunsets, and there's a few technical updates, and then the same thing is done, striking the sunset for the Regional Council on Trauma. And then the Senate bill that passed, or excuse me, this bill passed. I'm going to look at the vote count. 2158. Let's see, I'll have to check the vote count in the House, but the Senate vote was 39-0, and there was not an amendment made by the House, but an amendment was made by the Senate when they heard this bill earlier this week. And I will double check the vote in the House, and while I do that, I'll be happy to answer any questions.
Jenna, thank you for that explanation. Committee, do we have any questions for Jenna on the bill explanation? Okay.
And I have the vote, sorry, excuse me, Mr. Chair, on the vote in the House was 121-1 for 2158.
Thank you, Jenna. Committee, no questions for the reviser. Kendra, are you available online now for your testimony?
I am. Can you hear me?
We can, Kendra, and welcome to the committee. If you would just state your name and who you're representing.
Yes, absolutely. Good morning, committee. My name is Kendra Baldridge. I'm the director of the Bureau of Community Health Systems at KDHE, and the Kansas Trauma Program is one of the sections and programs within my bureau. Should I go ahead and move forward with my testimony?
Yes, please.
Okay, thank you very much. Thank you, Chairman and committee, for your time this morning. I appreciate being able to offer some testimony this morning, and I know that you all have heard testimony on the Senate bill related to this. The statutes that relate to the Kansas Trauma Program contain 2 sunset clauses that revolve around the protection from disclosure of healthcare providers during regional performance improvement meetings and performance improvement activities, which can occur at the Advisory Committee on Trauma meetings. This bill recommends that those statutes be amended so that these performance improvement initiatives can continue. These initiatives are the agency's way of ensuring that trauma patients are treated and transported in accordance with the latest industry standard. Without protection of the healthcare provider, performance improvement initiatives will be difficult, if not impossible, to be conducted. Peer review is important to the continued improvement of trauma care for all injured patients in Kansas, and it is through this process that traumatic injury prevention programs are developed and monitored. KDHE is appreciative of this committee worked and passed out of committee the Senate Bill 170, a mirror version of House Bill 2158 on February 23rd. And thank you for your time, and I'm available for questions.
Kendra, thank you for your testimony. Committee, do we have any questions for Kendra? Not seeing any. Kendra, thank you very much.
Thank you
for being with us today. Committee, we did have written testimony So that is on your file online. We do not have any other proponents unless there's someone here wanting to testify as a proponent. Not seeing any. And we do not have any neutral or opponent testimony. Is there anybody wishing to testify as a neutral or opponent? Not seeing any, we will close the hearing on House Bill 2158. Next, we'll turn our attention to the hearing on HB 2234, requiring medical directors of emergency medical services to provide medical oversight. And we will now open that hearing and for a overview of the bill with our revisor's office, Jenna Moyer. Jenna?
There we go. Thank you, Mr. Chair. House Bill 2234 would require medical directors of EMS services to provide oversight of those EMS services and the emergency medical services providers. And this comes to you from the House Committee on Health and Human Services. And it changes or it amends KSA 2020 SEP 65611, which establishes all the definitions related to the EMS board and emergency medical services providers. And it defines medical oversight as to review, approve, and implement medical protocols and approve and monitor the activities, competency, and education of EMS providers. And then it also amends KSA 2020 SEP 65612 to provide that a medical director would have to provide medical oversight. And then it makes conforming amendments in KSA 2020 SEP 656126 that each operator would have a designated medical director to provide medical oversight. So it would require each operator of emergency medical services to have a medical director. And with that, I will be happy to, I'll give you the vote count. It passed the House 123-1. And with that, I'll be happy to answer any questions.
Jenna, thank you for that explanation. Committee, do we have any questions for Jenna? Senator Petty.
Thank you, Mr. Chairman. Jenna, and I don't think this, well, you just brought it up about within this bill about having to have a medical director. And how is that medical director selected by each of these boards, emergency medical boards?
Thank you, Mr. Chair. I will have to check into that. What the bill specifies is that that medical director has to be a physician. And it might not be in this statute, but if that's not something that one of the proponents can give you more details on, then you can loop back around to me.
Okay, thank you.
Any further questions on the bill explanation? Okay, seeing none. Jenna, thank you very much. We will now turn our attention to our proponent testimony. And our only proponent that we have today is Joe House. And Joe, welcome back.
Thank you, Mr. Chair. It's been such a long time. So, Joe House, Executive Director of the Emergency Medical Services Board. Senator Petty, I'll answer your question right off the get-go. Those are hired by those local entities. So whether it's a city, county government that's the operator, they select their medical director that's going to provide this medical oversight, and that's done today. This isn't anything new for that portion of it. Every ambulance service in the state has one that's designated as such.
Sure, Senator Petty.
So they're hired by either the city or the county?
By the operator themselves, whether that's a city, county government, whether that's a private entity, whether that's a hospital that operates an ambulance service, but whoever operates the ambulance service hires those individuals.
Whoever operates the ambulance service in that region, I know it probably varies.
Yeah, it varies quite a bit because we don't actually give a regional thing for a permit. We just give them the ability to do anywhere in the state.
Wherever they're providing that emergency service, then they are the ones that hire the medical director?
Correct.
Thank you.
So the Emergency Medical Services Board is obviously in support of House Bill 2234. We are your agency charged with the responsibility of oversight of all things EMS related. And EMS is that emergency medical services piece. 2234 fixes two problems, problems that have been ongoing for quite a long time, and it gives us those solutions as we move forward. So one, about 4 years ago, we started talking with medical directors, and the question that came up was, what exactly is medical oversight? What is the board looking for when you say medical oversight? Easiest way to do that and to take care of that was to add a definition. It really moved things from 6126 into the definitions aspect, but it made it a whole lot easier for them to see exactly what their responsibilities were as they were stepping into this. The second piece is really a process issue. So EMS was born in the early 70s, has grown as it's gone through. At that point in time, county medical societies were extremely prevalent. They were everywhere. Every county had one. All the physicians within the county belonged to that medical society. Over time, that's started to kind of dwindle a little bit. And what we're hearing is that we still have some that are very, very active, and we have others that aren't necessarily as active. And it's not because they don't see value within it. It's because they just simply don't have the time to put forth into that anymore in all areas. We have many counties in the state that have very few, if any, physicians in that county. And so grabbing a society of one is not necessarily meet that intent. So in these meetings with our medical directors, with the Kansas Medical Society, we've been working to try to find out how can we look at approving these medical protocols, these directions as to what care is provided. So a medical protocol allows that EMS provider to initiate care prior to contacting a physician if a physician can't be contacted, and start down that path of treating that time-sensitive issue. So currently statute provides two methods for that to occur. One is approval by these local county medical societies. The second is by approval of a hospital to which that EMS service primarily transports their patients. What we've seen over time is the second piece of that hospitals providing that approval has turned into, for lack of a better term, a turf issue. If your best, and Senator Stephan, I hope you don't mind me using your area, but you've got a interventional cardiologist in the Reno County area. That's a great place to take a person that needs interventional cardiology from surrounding counties. But if you're going to your local hospital and saying, hey, with this patient, I'm not necessarily going to transport them to you first. I'm going to take them directly to where they need the care. But this hospital is looking at that protocol saying, well, we'd rather you come here first and then go on to the road. That's not necessarily the best care for that patient. When we've seen those occur, we've stepped in and said, hey, let's focus on the patient. Let's go with where they need to go, and resolves. But we're starting to see an uptick in frequency in those. The medical societies themselves, like I said, we have a couple that provide protocol approval, but really started to point out that they didn't want to reach outside of their catchment areas. So example here would be the Sedgwick County area. Sedgwick County EMS Medical Society, very robust society that's developed a set of protocols for use within their area. But they were approached by an ambulance service out of Nebraska that needed an approval process, and Sedgwick County said, well, you're providing care in northeast Kansas or in southern Nebraska and very extreme northeast Kansas. Maybe what happens if the care that we're providing you isn't necessarily what needs to go on within that area? And so they took it as being kind of a liability concern on their side, and whether they were directing care that they really had no ability to see what was going on later. That's what led us to the piece of saying, all of these services, all of these operators are required to have medical direction. Why don't we allow the medical director at that level to approve those protocols and decide what care needs to be provided in that area? And so that's what 2234 does. It takes that signature, that approval process, puts it on the medical director that has intimate knowledge of that service, the way that's run, the way that the communities that it serves, the physicians that are taking care of those patients, ultimately allows the protocol process to work, and really has been a solution that we've probably been looking for the last 4 years. We're happy to see go forth. and allows us that ability to tweak and modify into the future where we hopefully won't be in this same situation going, well, now we have a lack here. So with that, those are the two big areas that this bill addresses. Again, 4 years of work with our medical directors, Kansas Medical Society, and getting this through. Simple solution, it seems, which always makes us cautious as well in looking into it. It's kind of like it made it almost look too easy, but seems to be very widespread support from it and does place the onus exactly where it needs to be in that liability, exactly where it needs to be, and that's that physician that's responsible ultimately for the oversight. So with that, we would urge your support of House Bill 2234. I am more than happy to stand for any questions you may have at the appropriate time.
Joe, thank you for your testimony. And committee, do we have any questions for the conferee? Senator Petty.
Thank you, and thank you, Joe, for that explanation. So then, from what you've shared with us now concerning 2234, is that those medical societies are no longer a step within that of a possible approval area, and the EMS can start doing procedures to a patient that they might pick up before they actually have contact or approval from a doctor.
So thank you for the question, Senator. The medical society step is the approval of the protocol. The physician is still directing the care and always has directed the care, and our board wants that to continue. Physicians need to direct the care that's occurring. These are, I'll equate it to a cookbook. So I've got a list here that says when I arrive on scene and someone's having difficulty breathing, here are the steps that need to be done. That's the medical protocol. And that exists today. What we're saying here is the County Medical Society's large group is the one that's approved what this has said. Now we're saying the physician that provides the oversight, the responsibility to make sure all of these steps were followed is the one that approves it. If, and I would assume in this case of Sedgwick County, their choice is to say, hey, the County Medical Society is robust and taking care of this development and everything. We just need to be the signature to say, yes, these are approved for use. We would still hope that they use that medical society to get the consensus medical opinion as to how that treatment needs to occur. Does that answer your question?
And the legislation no longer speaks specifically to the medical society.
Correct.
Thank you.
We get my button pushing skills refined here this morning. Do we have any further questions for conferee? Okay, seeing none. Joe, thank you very much for your testimony. Committee, this is the only proponent testimony, the only actual testimony we have today. So unless there's someone else wanting to testify as a proponent, opponent, or neutral, not seeing any, we will close the hearing on House Bill 2234. With that, committee, I don't know if you remember, and I appreciate Jenna reminded me because I had some numbers confused and she reminded me. So thank you, Jenna. We are going to work House Bill 2062 first. That is my plan. And then I would like to, with House Bill 2062, if it's okay with the committee, also work House Bill 2158 and House Bill 2234. Do we have any objections to working those two bills that we just heard today? Okay, not seeing any. So committee, my plan is House Bill 2062 was the mirror bill. I know there's some, I want to get it close to how we passed it out of the committee. So I have Jenna's working on an amendment for me, and I apologize. I didn't follow up till late, so she's going to be working on that for a couple minutes. But it's the law enforcement portion, but it's just tweaked a little bit to hopefully comply a little bit more with the board's concerns. So then that would go out, if that was put on, that would be just like the bill that we passed out of the Senate with just a minor adjustment to it. And then do we have any other amendments on HB 2062? Or what is your, committee, what is your desire on HB 2062? Senator Petty.
Thank you, Mr. Chairman, and I'm glad you referred to the Senate bill, which is Senate Bill 83. And Jenna does have an amendment for Senate Bill 83. And while she's pulling that up, it was the amendment that was approved by this body on the floor to Senate Bill 83. And you might recall, I shared information when we were on the floor working this bill concerning the ability for local, do they have that yet, Donella? She's just put it up there.
And I just emailed that out to Danola.
So it would be the same as what was added on the floor. It's for local, and as it says, an entity established by a city or county for the express purpose of providing a local review of child deaths if the information and records being closed are related to a child's death, and it has to be specific to that city or county and the resident of the child within that city or county. This is as I share with you on the Senate floor, this is a number one priority for Wyandotte County. Sadly, we have had in the last couple of years, particularly last year, a high number of youth deaths, and we have established a youth fatality review board within the unified government to better find and establish techniques to reduce the number of youth deaths in the community. And so the addition of this ability to receive this information from the state would very much help not just my local government, but any across the state that would want to set up a committee to look at specifically for their region, to look for approaches for how they can work on predictability and therefore prevention. And that's truly very important for Wyandotte County. So that's the amendment that you may have pulled up already. Thank you. And as I said, this did go on the floor of the Senate before we passed the bill out.
Is that your motion to?
Yes, I make a motion to add the amendment.
We have a motion on the floor by Senator Petty to adopt this amendment. Do we have a second? Senator Holscher seconded it. Okay. Do we have any discussion on this amendment before we take it to a vote? Not seeing any discussion. Or Senator Steffen?
Thank you, Chairman. How will that amendment affect confidentiality?
Do you want me to speak? So thank you, Senator Steffens, for that question. This, I don't think it would, I mean, they would definitely be working within the parameters that within the bill. And this youth, in my case, I can just refer to what we already have established in Wyandotte County, the Youth Fidelity Review Board will only be looking specifically at those youth deaths that have occurred within Wyandotte County. And as I'd share with you, actually within my own Senate district, that last year there were 5 youth fatalities. And so they'll only be looking specifically at those and to make decisions about how to address the issues that are specific to our county. And what are the systemic problems that they can do to reduce those numbers of childhood deaths.
Any further questions on the amendment before we take it to a vote? Not seeing any. All those in favor, say aye. All those opposed, no. A motion is carried. That amendment is adopted. Senator Petty.
I've got a little more information here I can add for Senator Stephan. So this review board's terms are confidential. They have terms are confidentiality, and they're multidisciplinary teams that conduct an in-depth review of an individual's death. So they are maintaining the confidentiality that I know you're referring to. There's no interest in placing blame on a community agent or the victim. The purpose is to understand the circumstances and risk factors so that future deaths can be preventable. And that's what, we want to achieve within our county. And hopefully this is not an issue within your county and will never be. But it would, our panel would be looking at youth deaths, child and youth deaths between the ages of 1 and 24.
Do we have any other amendments on House Bill 2062? Okay. Jenna, are you okay for the amendment that I had for the law enforcement piece?
Mr. I have it in an okay enough spot. It's not perfect, so I would ask the committee for a little bit of leeway for grammar and just getting some of these boxes in the right place. I usually like to have them all the lines straight and everything, but that just might not happen today. But it's good enough to explain. Let me save this. And then share.
Mr. Chairman, this is Ed Clumps. Yep.
So this would be Amendment A. Oops, there you go. Okay, so I'm going to email this to Danola, and then we can chat about it more if you need me to explain it.
Jenna, thank you. And just to give the committee a little bit background to this, other than I just gave this to Jenna about 5 minutes ago, I had thought I had sent it to her earlier or someone else did. So Jenna, thank you for being a rock star and getting this out in 5 minutes. So any mistakes on that are strictly the chair's fault. So I apologize. But this, if you guys remember back, Ed Clump with the Law Enforcement Sheriff's Association and stuff, they had an amendment that we had put on in committee when we heard Senate Bill 83. The Child Death Review Board had a couple of concern with how it was worded. This revised amendment hopefully addresses that concern. So as soon as you guys have that, we'll let Jenna explain that. Okay, Jenna, can you go ahead and explain that amendment, please?
Oh, sorry, I forgot to unmute myself. So this amendment would take essentially what the Senate did in the Senate version, which would be SB 83, and make a couple of adjustments to it. So what passed out of the Senate was that the board determined that the cause of death, what this committee added was an exception allowing this information to be released if the board determined the death was from abuse or neglect, or that they had knowledge that a law enforcement investigation was going on. And this amendment would switch that up a little bit, and it would say that it would keep this exception in place and add, and either A, the cause of death was from abuse or neglect, or the board determines that the cause of the child's death was from abuse or neglect, or, and I need to add in and then it goes down to here, or the board does not determine that the child's death was from abuse or neglect, and the board would have knowledge that a law enforcement investigation based on official response an official offense report as required in KSA 215101A of abuse or neglect involving the death of a child had been filed. And then
Jenna,
it would
thank you.
put that in both, in both 4 and 5. So both to law enforcement and to the county or district attorney records.
Thank you, Jenna. And just a little bit more to it. I don't know if you remember, but it was, the board's concern was maybe, well, if the police department it wasn't anything to do with abuse or neglect, but they were an inquiry on something, would that justify this? And this just clarifies that it has to be for abuse or neglect, and that there is a police report or open a report on that for abuse or neglect. So with that, I will move my amendment. Second by Senator Thompson. Do we have any discussion on this amendment before we take it to a vote? Senator Petty.
Thank you, Mr. Chairman. Could you just, or Jenna, reiterate, so does this then, does this mean then that access to that information will not be available? Or I'm still quite, I mean, thinking back to Ed's testimony, which I thought was compelling, but I'm trying to understand the amendment. So under A, which is a new A, the information and records being disclosed were not previously available to such law enforcement agency for the investigation of the cause of the child's death. Either, Jenna? So does this then reduce the access to the information or change the ability of the access to the information? I'm trying to understand that.
Thank you, Mr. Chair. I'm not sure that it really reduces the access to it. It gives the board the discretion to make sure that the child's death was from abuse or neglect, and it would add in that requirement that an actual law enforcement investigation had been opened based on child abuse or neglect involving the death of a child. And so it would just add in some specificity. I believe the board had spoke about its concerns that they didn't want to be a clearinghouse for every law enforcement investigation that might open up involving a child. And this would keep it specifically to those involving the death of a child related to abuse or neglect.
Okay, so in line now A, it begins then with the board determines that. Is that
Yes.
correct?
Correct.
And then it goes, the board determines that, and then does it go to or?
Yes, and this is, this does make it a little more clunky to read with all the extra arrows. So it would read that the information could be disclosed to law enforcement, or in 5, to the county or district attorney, either A, the board determines that the child's death was from abuse or neglect, or B, the board does not determine the death was from abuse or neglect and has knowledge of a law enforcement investigation based on the report of abuse or neglect. And this would go to what Ed Klump had talked about to help with their investigation to help close out a child abuse investigation.
Okay, thank you very much.
Jenna, thank you for explaining that. Committee, do we have any further questions on this committee or this amendment before we take it to a vote? Seeing none, all those in favor say aye. Aye. All those opposed, no. That motion carries. That amendment was adopted. Committee, next thing I would want to do, since we're done working on House Bill 2062, I would like to combine what we've worked with on House Bill 2062, take those contents and insert it in with House Bill 2158, so combine those two bills. and I will make that as a motion. And House Bill 2158 was the first bill we had a hearing on today. That was the statewide trauma program. Have a second by Senator Thompson. Any discussion on that motion before we take it to a vote? Senator Petty.
Thank you, Mr. Chairman. And I'm just going to ask the reviser, these two, so these, is there any conflict of putting these two together?
Thank you, Mr. Chair. I don't see any conflict in putting them together. The single subject that I would adopt them under would be an act concerning open government, because 2062 deals with the confidentiality exceptions that the State Child Death Review Board is allowed to make, and then 2158 deals with the open meetings and privileged records. And so it would be an act concerning open government would be what I would propose.
Thank you.
Any further discussion on this motion before we take it to a vote? Seeing none, all those in favor say, let me re-clarify what this, so we know what we're voting on. So the motion is to take the contents of 2062 as amended, inserted into House Bill 2158. And all those in favor say aye. Those opposed, no. That motion carries. Do we have a motion on House Bill 2158 now, as amended? And Jenna, should we make this a substitute for House Bill 2158?
That is completely up to your discretion. It's not necessary. Makes it go through proofing a little quicker if it doesn't, but it's completely up to your choice whether or not it needs to be a substitute.
Mr. Chairman, I'll make a motion that we pass out 2158 as amended, favorable for passage.
Committee, we have a motion by Senator Petty, a second by Senator Thompson to pass out House Bill 2158 as amended, favorably for passage. Any discussion on this motion before we take it to a vote? Seeing none, all those in favor say aye. All those opposed, no. That motion carries. House Bill 2158 is on its way to the floor. Committee, I do now want to work on House Bill 2234. Does anybody have any amendments to House Bill 2234? Okay, I do have one minor amendment if nobody else has one, and that would be to change it, the enactment date from the Kansas Register to the Kansas Statute Book, and I make that as a motion. Second by Senator Baumgardner. Any discussion on this motion before we take it to a vote? Not seeing any. All those in favor say aye. Opposed, no. That motion is carried and that amendment is adopted. Committee, what is your pleasure on House Bill 2234? Senator Thompson.
Thank you, Mr. Chair. I move that we pass out House Bill 2234 as amended, favorably for passage.
I have a motion by Senator Thompson, a second by Senator O'Shea to pass out House Bill 2234 as amended, favorably for passage. Any discussion on this motion before we take it to a vote? Seeing none, all those in favor say aye. All opposed, no. That motion is carried. That bill is going to the floor. Committee, we are getting really close to the last week, and with these bills going out, if there is any bill that you want to look at as amendments, please, on these future weeks, we're going to do the rest of this session the same way. So again, please have all your amendments to Jenna so we can try to work them. And then again, if we have a hearing on the same day, I will ask if there's any objections on working it, so to give you guys time for your amendments. So do we have anything else to come before the committee? Senator Petty.
So I know you had mentioned that to us about next week. Is that your plan for tomorrow?
Yes.
Thank you.
Anything else come before the committee? Okay. Seeing none, this meeting is adjourned. Thank you.